Hello, and welcome to Dr. B Talks About Paranasal Sinuses. I'm your host, Dr. John Burgoyne. I'm a practicing otolaryngologist in Austin, Texas. I have over 30 years experience in ear, nose, and throat, and I talk to people about sinuses all the time. Today's video is really to tell you what sinuses are. This isn't the sinusitis talk. This isn't the sinus surgery talk. This is the what the heck are the sinuses. So in the simplest way of stating it, sinuses are air-filled cavities in the bones of the face around the nose. So in this lovely woman, we've got this space on each side of her nose. There's another one inside between the eyes, up in the forehead, and there's kind of one in the back that's harder to see. These are the sinuses. So when we talk about sinuses, we can ask ourselves, well, does everybody have sinuses? Like, do all animals have sinuses? Who has sinuses exactly? Well, the fact is, lots of animals have sinuses. Most mammals, birds, including the dinosaurs, had sinuses, and crocodiles. Not really other reptiles, but crocodiles. So when we look at sinuses, like with a CT scan, we can see air is black in these, that these are pretty big, and they're full of air. And so this one's cut like this, and this one's more like this. But either way, it's showing these big spaces that are around the nose. They're not in the nose, and in fact, you breathe through here. You don't breathe through these big spaces at all. So if someone says to you, "My sinuses are blocked," what they really mean is their nose is blocked. But we often think of it as being where we breathe. We don't. We don't breathe through our sinuses at all. They also have really small openings. These sinuses, the big ones behind our cheeks, they have these tiny little openings into the nose. The rest of the sinuses, the openings are so small that we don't even see them on CAT scans. And it's important for me to re-emphasize that they're empty. They're full of air. There's nothing there in a normal sinus besides air. You don't breathe through your sinuses. Again, very important. So the lining tissue of these sinuses, just like the lining tissue throughout the nose, is lined with these little, we call them cilia, and they sweep stuff out. So you make mucus in here, it all gets swept out through the opening and takes any particles or anything that get in there with it. So it sweeps out stuff into the nose. If the sinuses are blocked, then sometimes that doesn't work very well, and one of the sinuses will fill up with goop. Again, sinus infections are a different topic that we'll talk about another time. So what do sinuses do? Well, there have been a lot of theories about this in the past. We talk about, some say, oh, they're to make the head lighter, less bone, more air. Some say they humidify the air. Increasing vocal resonance has been a theory. And finally, crumple zones like you have in your car for trauma. But here's the thing. I don't believe any of that. And let me tell you why. First of all, do they lighten the head? Well, the average head weighs about 11 pounds. And if all of the bones that had sinuses were replaced by solid bone, it would still only weigh 12 pounds. That's not very much change. Plus, if you didn't have the air in there, you just wouldn't necessarily need to make such a big, gigantic bone. So I think that's baloney. Second thing, do they humidify the air? Well, I already told you, we don't breathe through the sinuses, and so they're not going to be very successful at humidifying the air when we breathe. So, I don't believe that one either. Do they increase vocal resonance? Well, it's a little complicated. One could think that it might make a difference, but it's hard to know because people who have full sinuses often have stuffy noses too, and stuffy noses definitely change things. But a couple hundred years ago, not quite, about 150 years ago, there was a crazy ear, nose, and throat doctor who got an opera singer and a panel of music experts. And he filled up this guy's sinuses with milk and had the panel of experts listen to him sing his aria both with and without the milk in his sinuses. So this is a situation where he didn't change the nose at all, didn't really change the sound or the vocal resonance at all. So I don't buy it. I didn't quite put as big a thick an X in there, but I don't buy that that's the thing. And finally, crumple zones for trauma. Well, you know, the truth is forces that are strong enough to crumple the sinuses kill the animal. It's not saving them for longer reproductive life. And so there's no real advantage, certainly not enough of one to keep all of these animals, some of whom never have trauma at all, to have kept their sinuses. So I don't buy that at all. Okay, well, so what do I think that sinuses are for? Well, here it is. I think that they are trauma force redirection. Let me explain that a little bit. If you had your brain with a nice thick piece of bone ahead of it, this is the situation assuming there was no sinus, and you whack it with a force right on that thick piece of bone. Well, the truth is that that force will get transmitted straight through the bone and splat into the brain. So thick bone with a force causes a splat in the brain. What if instead you have this air-filled space here? Well, this time, if you hit the force, that air-filled space will cause the force to be directed around the brain. And so all of the force will go into the bone around the brain, greatly reducing the impact to the brain. So not crumple zones. This doesn't have to be crushed for this to work. This is for the kind of trauma that most of the animals that have sinuses get all the time. They butt heads. In fact, these guys have big sinuses. All the head-butting animals have big sinuses. But these are not animals that have been hit so hard they're going to crush their skull. It's not a crumple zone. It's a forced redirection system. People who don't have sinuses, sometimes they don't develop and you're left with bone. They do just fine. The only difference is they never get a sinus infection. So your sinuses, like your appendix, are mostly known for problems. So we know about them when they have sinus infections or growths in them or some other thing. And that's a different talk altogether. But I hope you sign up for that as well. That's it for today. This has been John Burgoyne presenting Dr. B Talks About Paranasal Sinuses. I want to remind you that my videos are for information and entertainment, and they are not designed to diagnose or treat any medical problems. I'd really like to think I didn't have to say that, but I really do. If you have a problem that you think needs to be seen, see a doctor. Don't rely on online investigations to give you diagnoses. If you're in the Austin area, please come see me. I'd love to see you. Go ahead and Google me, John Burgoyne. You'll find me quite easily. And remember, if you've enjoyed this video, make sure and press like down below. Share it. Subscribe to my channel. And I hope to see you back soon. Thank you.